If you've noticed that the week before you get your period that you want to quit your job, divorce your partner, and possibly eat an entire carton of ice cream, you may have PMDD. PMDD is a more severe form of PMS and affects about 10% of people who get their period. What happens in PMDD is that your brain reacts to the change in hormones. So there's not an abnormal level of hormones. Your brain is just reacting to the change in your hormones in your menstrual cycle. And that's why in the week before you get your period, you notice that you have some pretty intense symptoms. This is how you're going to get a diagnosis of PMDD and the treatment options for this disorder. The first thing you're going to do is schedule a problem visit specifically with either your primary care doctor, your OBGYN, or your psychiatrist if you have one. Then while you're waiting for this appointment, you're going to start keeping a menstrual cycle diary, documenting that the week before you get your period, you have these certain symptoms. At your doctor's appointment, they're going to ask you the following questions. In the week before you get your period, do you have any one of the following symptoms? Mood swings, sudden sadness, increased sensitivity to rejection, anger and irritability, sense of hopelessness, or tension, anxiety, and feeling on edge? And then do you have any of the following symptoms? You have to have a total of 5 to meet criteria. Difficulty concentrating, change in appetite, diminished interest, easy fatigability, feeling overwhelmed, breast tenderness or bloating, and sleeping too much or too little. If you've said yes to a total of 5, congratulations, you now have a diagnosis of PMDD. When it comes to treatment options, we have lifestyle changes, supplements, medications, and surgery. Of course, we're going to recommend lifestyle changes for everyone, and that includes things like finding an exercise routine that works for you during this time, and working with a therapist. For supplements, which is a nice option for people who don't want to go on medications or have a milder form of PMDD, we have a supplement called Chasteberry or Vitex. For medications, we're going to talk about 2 different options, either the option of stopping ovulation or the option of working on the neurotransmitters in the brain. For stopping ovulation, the most evidence-based option that we have is birth control pills. For the neurotransmitters in the brain, we're going to talk about using an SSRI, either just during the luteal phase or the entire month. If you have tried all these options and you're still not feeling better, the next option is an injectable medication called Lupron. If the Lupron works for you, we're going to have an extensive discussion about possibly removing your ovaries. There are obviously significant risks as well as benefits that come with an oophorectomy, so you'll have an extensive discussion with your OBGYN if you want to pursue surgery. I diagnosed 3 people with PMDD last week, and I had to tell each one of them that the symptoms that they were feeling was not normal, but that we have treatment options for them.